Well, good afternoon, everyone. This is Andy Ritter, and welcome to our August Employee Information Meeting. We have a special guest joining us today, which is the reason that we scheduled this a half hour earlier than normal. And he will be joining us shortly. He had a very, very tight schedule, so he is literally going to be able to pop in and pop out. And 1:30 was the time that he was going to be able to start. So I don't think he is on the call yet, but I will go ahead and introduce him, and we'll see if he shows up here shortly. So our special guest today is Dr. Joe Gastaldo. Dr. Gastaldo has been practicing medicine for 22 years. He is a specialist in infectious diseases, working at Ohio Health. Some of you may recognize his voice or recognize his face when he gets on the call. He regularly appears in the media talking about COVID, and he meets regularly with healthcare providers and others to inform them on public health policy. And he has even met with the governance committee here at Allied a couple of times to help us better understand COVID over the last year and a half. In February of this year, he was named Practitioner of the Year by the Columbus Dispatch and Columbus CEO magazine for his work in providing guidance and educating the public on COVID. And we're very fortunate to have him with us today. He has a really, really tight schedule, as you can imagine, and we have the opportunity for him to talk directly to us about COVID. And I did forward, we get about 25 questions from about 15 employees. I did forward those questions to Dr. Gastaldo. Time is limited. He will be able to address some of those and maybe not all of them. But and then lastly, Dr. Gastaldo has sent us some links to some helpful websites that we'll publish on SharePoint after the meeting. So Dr. Gastaldo, welcome. I see you've joined us on the call. I am going to, I think you have some slides today. Yes. I will go ahead and stop presenting and let you share those. But thank you for being here today.
Yeah, Andrew, thanks for the kind words. I'm very humbled and honored to be speaking to this group. You know, I'm just an infectious disease doctor. You know, I never really thought a couple of years ago I'd be doing all this with COVID, but you know, I'm very honored and humbled to be talking to you guys and really to be doing everything I've done in the setting of COVID. I'm here as a person of science, and again, science benefits everybody, no matter the color of your skin, how much money's in your paycheck, who you voted for, who you love. Science benefits everybody, and I'm speaking about science in my discussions and comments with COVID-19. So let me get my slides up here. Let me start sharing the screen too. And Andrew too.
We're not seeing the slide yet.
What? Yeah, you're muted, Dr. Gastaldo.
Perfect. Did you hear anything I said so far?
Not the last couple of sentences.
Okay. When I said I was an infectious disease doctor, did you hear all that?
Yes.
Okay. So you can see my slides now?
Yes, we can.
Okay. And I can stay on longer than a half hour, depending on what the schedule looks like on your end. I could stay for a little bit more. Okay,
great.
These are some high-level things of what we know and what I want you to hopefully learn from today. Vaccines, any vaccine and the COVID-19 vaccine, they reduce infection and transmission. It's not 100%, but the vaccines do reduce your chances of becoming infected. Vaccines prevent 90 to 98% of hospitalizations and deaths, and the vaccines, it's not 100%, they prevent roughly 80% of all cases of symptomatic infections. That's wonderful. We also know too that these vaccines are safe and effective. I'll go through what the review process looks like, but what's different now in August is we have given over 360 million doses of these vaccines, and even more so worldwide. You know, other parts of the country, other parts of the world are using Pfizer and Moderna and J&J. But in our country alone, over 360 million doses have been given. Like no other country in the world, there are very detailed mechanisms in place looking for adverse reactions and safety signals. And because of the millions of doses that we have given, we have found 3 of them that are very rare. And when you look at them all individually, the benefit of getting vaccinated far outweighs any uncommonly encountered adverse reaction of getting the vaccines. The next thing, variants are going to occur with higher rates of infections. Remember, as I said earlier on, if you get vaccinated, infections go down. We need to get infections down so low, we don't have to worry about variants. When we talk about infection, it's not just here in the United States, it's the whole world. What happens in other countries affects us. Other countries that get variants, those variants will eventually get here. But in our country, nationally, we want to have a perhaps more sinister variant not happen in our backyard, because that's where the variants cause more damage if they occur in your neighborhood. Everyone should be vaccinated to drive down infections and transmission. So I don't want to go into the details of too much, but I wish we could do a redo on some of the definitions. The D in COVID, look at that, I spelled it wrong. The D in COVID is disease. So you can have infection with this virus. There is no such virus as the COVID virus. The virus is SARS coronavirus 2. That's the name of the virus. If you have infection with this virus and you are asymptomatic, that's not considered COVID. The D in COVID is disease. You have to have symptoms. You have to have disease before that is considered COVID. I wish we could do a redo of the definitions of that. Transmission, transmissibility, that's the word we use to talk about being contagious, how contagious somebody is transmission or transmissibility. People who are fully vaccinated compared to those who are not vaccinated. People who are fully vaccinated are not as contagious as those who are not vaccinated. Natural immunity. I'm not sure what that, I know what people think that it means, but to say the word natural immunity, most people think that's immunity you get from natural infection. That also implies that the immunity you get from vaccination is unnatural, and that's not true at all. The way your immune system works from immunity from infection and immunity from the vaccine are exactly the same. There is nothing unnatural about the immunity from the vaccine. I would say, would you rather take your chance of getting immunity from infection or immunity from the vaccine? And hopefully at the end of this discussion, more people will say, well, I want to take my chances with the vaccine over the virus itself. Okay, let's kind of go through our current state. This is our current state with COVID-19. This is the positivity rates of the curves. And in the wintertime in our country, we were unfortunately averaging above 200,000 cases a day. And that obviously was very stressful for the hospital systems. We kind of came down here in the winter month or the summer months. And then look, our numbers went up. It's not just the Delta variant of why the numbers went up. Our cases are going up on, really, it's multifactorial. Yes, the Delta variant, but the predominant driver of COVID cases are human behavior. The CDC changed the mask recommendations, and I'll kind of go through what they were based on. But back in May, whenever they changed their mask recommendations, they gave the following guidance. If you are fully vaccinated in public, you don't need to wear a mask. If you are not fully vaccinated, you should still be wearing a mask. That was the guidance that was out there. That's not the message most people heard. The message most people heard was, I don't need to wear a mask anymore. That's one of the reasons why things are going up. The Delta variant, we've hit a plateau with getting vaccines into people's arms, and then travel. Those collectively are the reasons why cases are going up. Cases are up in our country 86% from where they were 14 days ago. Hospitalizations are up a whopping 85% from where they were 14 days ago. And deaths are up 102% from where they were 14 days ago. This is a graph that really looks at different areas of the country and their positivity numbers. And the take-home message is this, and I think this doesn't surprise anybody at all. Areas that have less uptake of vaccines are hotspots with COVID-19. Central Florida, Jacksonville, New Orleans, Houston, Texas, other cities in Texas. Those places are on fire with COVID-19. Their cases are through the roof, their infections are through the roof, their hospitalizations are through the roof, and those places are struggling with taking care of patients in the hospital because those places are on fire with COVID-19. One of the things that's really driving Florida is the weather. When it's hot and steamy and high humidity down in Florida, that's essentially their winter when people are indoors more. You can see the hospitalization curve for the country is going up in the wrong direction. We are at the same level of hospitalizations now as we were last summer. Okay, let me get back to my slides here. Okay, so that's the current state. To get to a better normal, get vaccinated. I can think of very few reasons why somebody should not be vaccinated. If you're vaccinated, we want you to lead by example. Share your experience. It is not a HIPAA violation to ask somebody if they have been vaccinated. They don't have to answer it. HIPAA has nothing to do with people talking. HIPAA has to do with how healthcare records are stored. We still want people to follow the CDC recommendations on mask wearing. If you live in an area of high or substantial community transmission of COVID, you should still be wearing a mask. It is a much riskier scenario for unvaccinated people to go out and about in the setting of what I just described going on. Moving forward this winter, it's even going to be more dangerous here in Ohio this winter because of people being indoors more, and we're going to see more respiratory viruses. In the pediatric world, they are seeing a lot more infection with RSV, respiratory syncytial virus. That's mostly a pediatric viral respiratory tract infection. Here's what the vaccines do. The vaccines defang the virus. They prevent people from being hospitalized. They prevent people from dying. In many people, not all, in many people, the vaccines also prevent infections and transmission. It's not 100%. And with the Delta variant, the vaccines are a little less effective in stopping infection with the Delta variant. If you get COVID-19 after vaccination, you are more likely to have a mild respiratory tract infection. No vaccine is 100% protection, but we really have to keep in mind that vaccines don't work as well in elderly people and people with weakened immune systems. I would hope nobody on this call would want to consciously contribute to somebody being hospitalized or somebody's demise or cause of death. But a big reason for a younger, healthier person to get vaccinated is this, so they don't spread the virus to somebody who is at risk. How do the vaccines work against the Delta variant? This is effectiveness. This is real world data on the effectiveness of the COVID-19 vaccines against the Delta variant. This is a publication from the New England Journal of Medicine. The Pfizer vaccine is 94% effective in preventing symptomatic disease. I'm not talking about asymptomatic infection. 94% effective in preventing symptomatic disease and 88% effective for the Delta variant. So with the Delta variant, you still lose a little bit of effectiveness in symptomatic disease. But what matters the most is the vaccine keep you alive and keep you out of the hospital. Its effectiveness is wonderful for the Delta variant. Alpha and Delta, 95% effective in preventing hospitalizations, 96% effective against the Delta variant. At Riverside Methodist Hospital today, this morning, we have 28 people in the hospital. And guess what? 27 of them were people who were not vaccinated. We have one person with a weakened immune system who was vaccinated, who was sick enough to come in the hospital for COVID-19. That number is the same all over the country. The vast majority of people in the hospital are people who are not vaccinated. And I'm asking you, in the hospital, we are very much at capacity. We're at capacity with non-COVID related hospitalizations because we're still catching up on care for people who didn't have adequate timely care because of the lockdowns we had this past spring. We're still catching up on doing that. And things in the hospital without COVID are very much spread thin, and we are at capacity. So now we have to deal with what we're doing with people catching up with non-COVID healthcare and taking care of more COVID hospitalizations. The vaccines. These vaccines are not experimental. The experiment or clinical trial was done. I'll kind of go through that a little bit, but the same type of trial or experiment that was done on these vaccines was actually better compared to previous vaccines. Yes, it is true. At this point in time, the vaccines are not FDA approved. They are FDA approved under emergency use authorization. When you look at the detailed difference between FDA emergency use authorization and FDA approval, the differences are minimal. There's not that much difference at all between FDA emergency use authorization and FDA approval. The differences are minimal, but the studies were done the exact same way. The way the studies were reviewed by 3 independent and transparent review boards. No other country does it this way. In addition to that, we have safety mechanisms in place looking for any safety signals. There are over 8 different mechanisms out there that the FDA and the CDC have looking for any potential safety signals. Everybody's very familiar with VAERS, the Vaccine Adverse Event Reporting System. Many people don't understand VAERS. But there's other mechanisms in place. And the one that was created brand new for this vaccine that didn't exist before was V-Safe. When you go to get vaccinated, you're given a QR code and it connects you with the CDC. And every day after you're vaccinated for 7 days, you get a daily text from the CDC to say, hey, how are you doing? After that, you get vaccinated weekly for 6 more weeks. And then after that, you still get a text from the CDC. I was vaccinated in December, and last week I got a text from the CDC asking me how I was doing with the vaccine. The way these vaccines work, they work the exact same way as other vaccines. They trick your immune system into developing an immune response to a protein or an antigen. But when you get injected with these vaccines, what you're injected with is dissolved within hours. It doesn't float around for days and days and do bad things into you. It induces an immune response, and the immune response in most people is gone within a few days after being vaccinated. But what you're injected with is dissolved within hours. It doesn't stick around. It doesn't alter your DNA. It doesn't do sinister things to your body. In addition to that, in the whole history of vaccines, remember, we've been given vaccines now for over 100 years. In the whole history of vaccines, there has never been a vaccine that gives you a toxic reaction years down the road. Vaccines don't work that way. What you're injected with is gone within hours. You have immune response for a few days, and that's it. When we talk about things that cause cancer, those are things your body gets exposed to over a long period of time, like cigarette smoking. Smoking one cigarette is not going to give you cancer. It's smoking cigarettes over many, many years. Skin cancer is the same way. Skin cancer, it's a cumulative effect to something that changes your DNA. These vaccines don't work that way. No vaccine works that way. Mythbusters. Vaccines do not magnetize people at all. Vaccines have no association at all with infertility in men or women. The newest thing going around says that the vaccines lower your sperm count. Guess what? COVID-19 lowers your sperm count. Vaccinated people do not shed the spike protein. The components of the vaccine and the produced spike protein are degraded. mRNA vaccines do not alter your genetic material or your DNA. Physiologically, it's impossible. This I talked about already too. Communities with lower vaccination rates are areas where there's higher levels of community transmission, and to surprise of nobody, more COVID-19 cases. This is the positivity numbers in various states: Nevada, Missouri, Wyoming, Arkansas, and Utah. They've all gone up. And what do those states all have in common? Lower cases of vaccine uptake. I talked about this already. I want to talk about vaccine breakthrough infections. They are very, very rare. When you get a vaccine breakthrough infection, you are very, very unlikely to be hospitalized or die unless you have an at-risk condition. You're not going to spread it as easy compared to somebody else. But at this point in time, breakthrough infections occur in 1 out of every 10,000 people. And again, that's a breakthrough infection. That if someone gets vaccinated and then they have an upper respiratory tract infection, the vaccine is working. The vaccine is working. That's what the vaccine is supposed to do. It protects you from what matters the most, being hospitalized and dying. Okay, I want to go through what the vaccine review process looks like. But before that, let me show you the in the weeds Pfizer vaccine. I could find it here. Okay, here's the Pfizer vaccine. This is their clinical trial. This is the experiment. These vaccines are not experimental. What they did in the Pfizer vaccine, they had 44,000 people, 44,000 people. Half the people got the vaccine, half the people got the placebo. You can see the makeup: half men, half women, 10% African American, 4.4% Asian, 26% Hispanic, a bunch of disease states. Their endpoint, after you were vaccinated, they said, hey, go live your life. If you get sick, call us. If you develop any COVID-19 symptoms, call us. Let's test you. They did that. Out of those 44,000 people, they measured 170 people who had symptomatic COVID-19. They were not doing daily PCRs. They were not measuring asymptomatic infection. They had 170 people who had symptomatic COVID-19. Out of those 170 people, 162 got the placebo. They didn't get the vaccine. There were only 8 people who were vaccinated who developed symptomatic COVID-19. So look, in this study, there were people who were vaccinated who still got symptomatic COVID-19. When you look at it based on severity of illness, out of those 170 cases, there were 9 people who were hospitalized and 1 person who died. Guess what? Those were all people in the placebo. All people in the placebo. Okay, I'm going to show you the review process on how a vaccine comes to fruition. No other country in the world reviews vaccines the same way we do. We have 3 independent boards that review the vaccine, and these 3 independent boards are the smartest people in the country. These are experts in their area. The first group is the Data Safety Monitoring Board. They are the only ones who know who had the vaccine, and the only ones who know who had the placebo. And once the vaccine trial is done and there's no safety signals, they tell the company, you have enough data to submit it to the FDA. A subcommittee within the FDA is called the Vaccines and Related Biologic Product Advisory Committee, called the VRB-PAC. This group is open to the public. This table, who's at the table, is the who's who of scientists, infectious disease doctors, vaccine specialists, ethics people. There is no politician who sits on this group. And this group, when they meet, it's open to the public. You can go online and listen to this group. For me, this is must-see TV. I watch all of this. And when this group meets, it's not a love fest. You have a group of very smart people meeting with representatives from Pfizer, Moderna, and J&J, and they ask a lot of tough questions. This group makes a recommendation, a non-binding recommendation, to the leadership of the FDA. And if it was FDA approved or FDA authorized, it's irrelevant. They vote the same way. So this group's vote is non-binding. They give it to the leadership of the FDA, and it's up to the leadership of the FDA to either authorize or recommend the use of the vaccine. So it could be that this group says, you know what, we don't authorize the vaccine, but the leadership of the FDA overrides them and says, we're going to give it out anyway. That doesn't happen. I would not recommend a vaccine to anybody if this group did not recommend the vaccine. I would not consciously recommend that for my patients, my family, or myself if this group of very smart people, experts in their fields, did not vote in favor of authorizing the vaccine. After the FDA authorizes the vaccine, before it becomes available, it has to go to another group of very smart people. This is a subcommittee within the CDC called the ACIP, the Advisory Committee of Immunization Practices. This group has 15 voting members, experts in their fields, no politician. In addition to that, this group has representation from every major medical society, including ACOG. I just want to get this out of the way. ACOG is the Academy of the Academy College of Obstetricians and Gynecologists. They are the ones who are the experts in women and pregnant women's health. And on July 30th, hands down, without any reservation, this group makes a strong recommendation that all pregnant women should be vaccinated. And again, these are the experts in their fields. They would not make that recommendation if the science and the data did not support that. Just today, the CDC moments ago had a press conference strongly recommending all pregnant women to be vaccinated. So this advisory group of immunization practices, they are the ones that leave the recommendations for the vaccine once it gets through FDA authorization. I feel quite confident that once there is a vaccine out there that gets through this review process, it's something that people can safely take. What's different now between December is we have given over 360 million doses. We have safety mechanisms in place looking for signals. Here's an example of the safety signal mechanisms working. Everybody's very familiar with the VSafe. I talked about that. VAERS, a lot of people don't understand VAERS. Anybody can report anything on VAERS. You can look it up online, and people say, well, Dr. Gastaldo, if you go to VAERS, there's 6,000 deaths with the vaccine associated with VAERS. Just because something is reported on VAERS does not mean the vaccine caused that. Just because the rooster goes cock-a-doodle-doo every morning, that is not the reason the sun comes up. This is an early warning mechanism. So I'll show you how VAERS worked when it came to the first safety signal with the J&J vaccine. So the J&J vaccine in our country, we started using the J&J vaccine on March the 2nd. From March 19th through April 12th on VAERS, there were 6 cases of a very rare but serious type of blood clot reported with the J&J vaccine. 6 cases. They were all reported on VAERS. The last one was on April the 12th. On April the 13th, the CDC and the FDA put a pause on the use of the J&J vaccine to take a deep dive into that very rare type of blood clot and to also have an opportunity to educate people. So this is data as of May 7th. As of May 7th, it's a little bit more, but not that much more. As of May 7th, there were close to 9,000 doses of the J&J vaccine reported to VAERS. Out of 9,000 doses, there were 28 confirmed cases of this very rare but serious type of blood clot. No cases reported with Pfizer, no cases of Moderna. We know about this blood clot. There's guidance given to patients about this blood clot. It's very, very rare. When it occurs, it's something that is treatable. That same mechanisms exists also too for myocarditis and pericarditis. There's roughly been 1,200 cases reported, but I could tell you though, if you look at myocarditis and pericarditis, there's a much higher association reported with COVID-19 compared to the vaccine. Okay, finally, before we open up the questions, the Delta variant. This is the Delta variant. The Delta variant is the wolf looking for people to infect. I'm one of the pigs in the brick house of being vaccinated. If you're vaccinated, you have a wonderful layer of protection against infection. If you are not vaccinated, whether you have a comorbid condition, whether you are young and healthy, you're living in the straw house where the Delta variant big bad wolf is going to come blow down your house and you're going to get infection. If you are younger and healthy, yes, you are less likely to be hospitalized and die, but you could very likely spread it to somebody who has an at-risk condition who's been vaccinated or not. And I'm asking you to get vaccinated. We need help in the hospital. We are at capacity. We are at bed capacity because of COVID-19, and we are still catching up on delivering healthcare to people who put it on delay because of the changes that COVID-19 had this past winter. So I'm asking you, talk to somebody who knows this. I've been talking about COVID-19 for a year and a half. There is nothing political about these vaccines. We need to get on with our lives safely. And the way to do that, to get on with your life, is to get vaccinated. So with that in mind, I'm going to open it up to all kinds of questions and comments. And this is a non-judgment zone. I want to respectfully engage anybody. And I'm talking to you guys from a vantage point of caring and understanding. This is what I do for a living. I know there's a lot of misinformation out there. And I can tell you, when I have private conversations one-on-one with people, people are choosing not to be vaccinated based on misinformation or a misunderstanding of the things that I talked about. You know, these conversations are very nuanced and they are full of things that a lot of people don't have a detailed understanding of. So with that in mind, I'm going to stop sharing and you guys get to see my face. If I can figure out how to stop sharing.
Dr. Gastaldo, this is Andy Ritter. Thank you so much for that. That was really helpful, and I've been getting some notes from people as you've been talking, how much they appreciate it. Let me kick it off with one of the questions that was submitted to us, which is, should people consider getting a booster, and if so, is it safe, and when should they look at getting a booster?
Yeah, that's a great question. So at this point in time, there is no recommendation for anybody to get a booster. None of the vaccines that we have are CDC recommended or FDA authorized for a booster. One thing I could tell you is that some people in the population will need a booster. People who have weakened immune systems will probably get a booster, and people who are above a certain age will get a booster. The CDC Advisory Committee is meeting this Friday, and on the agenda for this Friday is booster recommendations for people with a weakened immune system. Young, healthy people, I don't think young, healthy people are going to need a booster. You know, there's a lot of debate on that in the infectious diseases community. When you get vaccinated, you get the immune response for antibodies, B cells, for T cells, but also memory cells. You have memory cells that last for years after you get vaccinated. I have immunity to many, many things, and I don't have circulating antibodies. There's more to the immune response than that. So moving forward, when it comes for the need for a booster, that decision is going to be made by the experts who should be giving those recommendations, not big pharma, not pharmaceutical companies. So stay tuned. The need for a booster is to be determined. It's not going to be for everybody.
And I think Dr. Gastaldo, I'll continue asking questions on behalf. I'll let the group know that if you want to add a question on the chat, then I will go ahead and read through, time permitting, those as well as those that were submitted previously, just so we don't crowd the meeting with a lot of people talking over each other. We've had, so moving on, we've had a number of questions regarding children. And so let me ask kind of two together, they're related. What is the current status and expected approval timeline for vaccinations for children under 12, and in particular infants? I'll let you answer that one first, then I'll have a related question.
Sure. So as you guys know, there's only one vaccine that's FDA authorized and CDC recommended for 12 to 18, and that's the Pfizer vaccine. Moderna and J&J are only authorized and recommended for 18 and older. So right now, both Pfizer and Moderna are doing clinical trials in children down to the age of 6 months. Down to the age of 6 months. Those clinical trials are happening. I don't know what the results are looking like. They haven't given us any teasers at all, but those clinical trials are happening. As a scientist, I want to know, what I want to know is, are they getting the same dose? What does the side effect profile look like? Are there any safety signals at all? So I don't know what those clinical trial results are because they're still happening at this time. I do know that the FDA has asked Pfizer and Moderna to make the size larger to potentially look for any potentially safety signals. We need to be safe. We need to know that these vaccines are safe in kids. So we don't want them to cut any of the corners at all to get the vaccines out there. But with the vaccine clinical trials, their endpoint is just exactly what I explained for Pfizer, symptomatic COVID-19, same for Moderna. They're going to have the exact same review process that I already decided. And then there's going to be mechanisms in place looking for safety signals after the vaccine gets out there. I could tell you, after the millions of doses given to 12 to 16 years old for Pfizer, they are safe. They are safe vaccines. We have given millions of doses to those age 12 to 16 with the Pfizer vaccine. We know about the very rare myocarditis, pericarditis, and the vast majority of people who get that have a mild case, and the vast majority of people get better with supportive care only. Back to your original question, I do feel confident in saying that by sometime this winter, no later than January of 2022, we will have vaccine availability for children, very likely down to 6 months old. And we get flu shots. We give flu shots to the infants beginning 6 months and older.
Great, thank you for that. And I know you sent a link to a website that very specifically talks about safety precautions for children, particularly going back to school. So I just to remind everybody, I will send that link out.
Yeah, real briefly, kids can get
Sure.
COVID. Kids can get COVID.